Hi, everybody. As you're joining, we're just going to give it a minute and we'll get started around 1. Great. Welcome, everybody. Good afternoon. I'm so pleased to welcome you to today's town hall. My name is Sarah Launderville, and I'm the Executive Director of the Vermont Center for Independent Living and President of the Vermont Coalition for Disability Rights, and your host for today. The Vermont Coalition for Disability Rights is a coalition of organizations fighting for and serving people with disabilities and families. And we come together to advance the human and civil rights of people with disabilities to ensure full and equal participation in all aspects of community life and life in the political process. Slide. I want to say a special thank you to the Vermont Family Network for taking the lead on today's workshop, which is part of their online series, Persevering in the Pandemic, and also a special thank you to all of our sponsors and panelists. Slide. Here are the presenters for today's town hall listed in the order in which they'll present. Each group of presenters will have 15 minutes to review some key points, and we reserved about a half an hour for question and answers at the end. Today's meeting is being recorded, and it will be saved on the Vermont Coalition for Disability Rights website, as well as the Vermont Family Network's website and YouTube channel. Everyone who registered for today's webinar will receive a follow-up email with the link of this recording. It's also being captioned today, so if you need that, then you can click on the button below to see that. All of our participants, unfortunately, are muted, but you can ask questions through the presentation, but the presenters will first review their prepared slides. You can please send your questions to everyone, all the attendees and panelists, so that everybody can see the questions being asked. And in the last 30 minutes of the call, we'll do our questions and answers. Please use that chat function at the bottom of your screen and ask your questions, and we'll keep an eye on that. You can also use the raise your hand function, and we'll work on unmuting you and calling on you so that you can ask your own questions. So I'd like to welcome all of our presenters and turn this over to Karen Price from the Vermont Family Network. Karen.
Hi. So I'm Karen Price. I'm the co-director of family support at the Vermont Family Network. Next. Vermont Family Network is part of a national network of parent centers. There is at least one parent center in every state. Parent centers help families who have children with disabilities or special healthcare needs. At VFN, we help families with educational, health, and other disability-related needs through our family support programs, including our helpline, workshops and webinars, and various other programs. We have helped thousands of parents over 30 years through the special education process, and I've developed a short series of slides to deliver some key messages to parents today. Next. Parent centers like Vermont Family Network are funded under IDEA, the Individuals with Disabilities Education Act. Why? Because one of IDEA's foundational principles is the right of parents to participate in educational decision making regarding their child with a disability. The law is very specific about what school systems must do to ensure that parents have the opportunity to participate in the IEP process. Parents are equal members at the IEP table. We at VFN help parents to be the best advocate they can be for their child. Next. The start of this school year has been challenging. If you, the parent, see that your child's program is starting to go off the rails, or if you are struggling to get your child to learn remotely, which the school might not be able to see, communicate promptly with your child's case manager or director of special education. The IEP is not etched in stone. The IEP is individualized and changes can be made at any time within process. You, the parent, are the expert on your child, and you have every right to ask for an IEP meeting when you know that something is wrong. Dispute resolution is available if there is a disagreement. Next. We hear from many families that while one IEP meeting used to be sufficient to start off the school year, many families have had to engage in multiple IEP meetings this year. To make the best use of your time, we recommend, these are our tips. First, checking the notice of meeting. Make sure you understand the purpose of this IEP meeting. 2, review your child's school paperwork. Ask the school for copies if you are missing anything. 3, gather any needed documentation from non-school professionals. So it's got to be therapists, it could be physicians, social workers who have knowledge of your child. 4, consider having someone else, a friend, a family member, a professional, to attend the IEP meeting with you for support. VFN does have some limited meeting support. And 5, think through what you want to accomplish at the meeting and put everything in writing. Next. So during the IEP meeting, be an active participant and listener. Ask questions if you need more clarity. You could consider taping the IEP meeting to maximize your ability to participate and to process the information. We recommend that you inform the team beforehand if you choose to do so. Next. Make sure everything you want documented during the IEP meeting is recorded. Even if you have to pause the meeting to do so, request a copy of the meetings, a copy of the minutes, review them, and submit corrections to ensure they are accurate. Keep those minutes with your child's educational records. Next. If your child is due for a special education evaluation or re-evaluation, it is important to ensure that the evaluation is comprehensive, as an IEP is only as good as the evaluation that it sits on. The Agency of Education has put out some COVID-related guidance regarding evaluations. Next. So during this tumultuous time, schools should be assessing your child to measure the degree of regression that may have occurred and to modify the IEP accordingly, again within process. Compensatory or COVID-19 recovery services might be necessary to help your child make up for any loss of skills. BFN has sample letters for parents to use if they feel they need to request compensatory services. Next.
Karen, 5 minutes.
Thanks. We want to remind parents that parent training and counseling are amongst the many possible related services that can be written into a child's IEP. What you see on the slide are just a few of the related services that could be available. Next. So the Vermont Family Network and Disability Law Project had developed a short webinar and infographic in August on educational options under the IEP, which is available on our website. During this confusing time, parents need to be aware that homeschooling means your child is no longer enrolled in a public school and loses their entitlement to an IEP. They lose their entitlement to FAPE, a free, appropriate public education. Also, an IEP education placement decision can include the home. The IEP is still in effect in the remote or hybrid school instruction model, and there are special considerations for homebound and hospitalized students. Next. The Act 264 All Coordinated Services Plan could be an option for some students on IEPs. It is not part of the special education process, but is another process available for those students who are eligible and allow multiple providers, of which the school is one, to collaborate around wraparound services for a child and family. Next. So I'm closing here with a few websites. I did not include the information for any of our partners participating in the town hall, as I'm sure they will share their contact information with you. My final message to parents is that you are not alone. We at the Vermont Family Network are parents of children with disabilities and special healthcare needs ourselves. So call us and we are here for you. Thank you.
Hi, everybody. Can everybody see me? Can you hear me? This is Jackie Kelleher. I'm the State Director of Special Education for the Agency of Education. It is a privilege to be here. It's wonderful to follow Karen Price. We consider Vermont Family Network a valuable partner in what we do. They're a wonderful PTI for the state. I particularly echo things that Karen has said, including one of the most underutilized related services we have is that parent training and counseling component. You are partners in this process. You need to be at the table. You need to have the information and the tools necessary to be able to be engaged with your child. So I'm echoing that and just saying, you know, that's something that if you wanted to follow up with AOE, you know, we would love to talk with you further. Today, we're just going to highlight, myself and some of our staff team members are just going to highlight some of the recent back to school guidance that's been issued by AOE, just to give some highlights. We do at the Agency of Education 2 resources. If you go to the Agency of Ed website, there is a COVID section, and we have an entire section dedicated to special education. And everything that we have been coming up with over the past 6 long months together. We also have a special education website with 12 different sections to be able to get resources and information to help you understand the system, to help you become more engaged, and ultimately to improve outcomes for kids. Next slide. So for the Agency of Education, I just want to recognize our vision. Our goal is about improving outcomes for children and youth with disabilities, and our focus is on access, equity, and opportunity. And it's so important for us to engage with our stakeholders, which include you, as we do our current work and our work in the future. Next slide, please. I certainly can't do this alone, that's for sure. We have a fabulous team of experts at the Agency of Education that support special education initiatives across the state. We're here for families as well as professionals, our local education agencies, which are our school districts, our advocacy organizations, different disability groups. This is our team, and we do have Tracy and Katy and Ernie with us today. But I also wanted you to be aware of the wealth of expertise. So we've got teachers, administrators, policymakers, parents of children with disabilities. So we have a well-rounded team who's here to serve and support. Next slide, please. Please use our technical assistance. We are here 24 hours a day. We are accessible by phone or by email. We really want to be able to provide you with the information that we possibly can, or guide you in the right direction, again, in partnership with organizations like DFN, Disability Law Project. So please take advantage of our resources. Next slide. So one of our guidance documents that has come out recently is about assessing COVID-19, the impact. We understand during this challenging times that with the IEP process, that it's critical now more than ever to review and as appropriate revise the IEP. So we gave out some guidance of considerations for school districts and families to be aware of, that was to supplement and to clarify our July 28, 2020 guidance that was located here, called COVID Recovery and Compensatory Education. So I'd like to just explain some further details that came further. Sorry, next slide. So some highlights. So we understand at this time the big priority as schools reopen is the health and safety of our kids, of our staff. It's about addressing the socio-emotional needs that are, likely, necessary, have changed, might be different, might be more pronounced. Really getting that healthy, strong start in place. With that said, we talked about COVID recovery services, comp services. We talked about that, and there was some responses from the field, from parents, from organizations, asking if this was a new entitlement. How do we describe FAPE during COVID? And we're not asking for a new entitlement. We're not asking for new rights. We're not creating new entitlements in that way. We're basically just going back to basics and reminding all of ourselves what we need to do during this time. And at the end of the day, it's really about reviewing and revising that IEP as appropriate, given the current circumstances and what has transpired in the past 6 months. Next. So development, review, and revision of the IEP, not a new entitlement. It is the law, it is the rule. And so we're really stressing, particularly for districts and IEP teams, including parents as partners, to look at, has there been a lack of progress towards annual goals, a lack of expected progress in the general curriculum? Remember, our kids with disabilities, our eligible students, they're general ed students first. Special education is the layers around of supports and services to allow that access to gen ed. So we have to consider that first. And then what else might be necessary to address any supplemental services as appropriate during this time. Next. This is going to take time. So this was something else that we clarified in the recent guidance. Some folks are thinking this is going to happen right away. At the end of the day, to make these decisions, to make strong, targeted, individualized decisions, we need reliable and valid information. And that's not going to happen overnight. So we said for our districts, this might take 12 weeks or even a complete marking period to collect this necessary information. And that time frame could expand too. But to get it done right and well, we need to make sure we have the right information for those decisions. As far as any supplemental services or additional supports that might be necessary, that too is going to take time. If you think about it, if we were going to do everything all in the school day starting now, some of our kids could be in school for 18 hours. That's not the way it can work. That's not best practice. That's not going to help improve outcomes for our kids. So it's going to take some time to be able to look at the impacts over the next 12 months. But we really want to have the students' needs at the forefront during this time. Next slide. And then, as with all team decisions, documentation is key. Wanted to share with you that we're giving that guidance, that the traditional measures that we captured, student progress and objectives. These are the same documents we still need to be using. And we've really encouraged that communication with parents, that collaboration, interaction with parents as key to this process. Next slide. Yeah, we're turning it over to Tracy Harris at this time. You may need to unmute, Tracy Harris.
Yes, sorry, I got booted offline. I apologize. But I'm here to talk about a recent guidance memo that went out that I helped create. And the document refers to behavioral interventions now that school is in session. So these are the sort of behavioral supports that we would like to see schools using when they, once they have their students back in school. And although restraint and seclusion is not a behavioral intervention or a support, it's really just an emergency procedure, but we did give some guidance around that as well. So first and foremost, what we are advising schools, and I think you may have heard the secretary and the governor speak about this in in several of their recent addresses, is that for these first few weeks, we need to be kind and gentle to ourselves and to the students. We need to have a period of adjustment here. We've all been through a lot, and we need to first attend to just a period of adjustment. We need to infuse social, emotional supports into everything that we do. We need to reintroduce all of our old rules and expectations. We need to teach and model and practice new expectations related to health and safety. We need to expect that we're all going to make mistakes around that. And what's important is to be kind and gentle and offer supports and interventions for those that are taking just a little bit longer to learn and to adjust. Now, at the same time, during this time of this pandemic, health and safety are paramount. So while we need to be kind and gentle, we also need to be firm about what our safety and health protocols are, our expectations. We're talking a lot with teachers about giving kids a rationale, not just throwing out rules, but explaining why. You know, we're teachers, they're students. School is about learning. It's not about hammering down. You know, we're here to teach them what is expected and why.
Tracy is going to give you the 5-minute warning.
Okay. Oh God. So difficulties that happen for kids that are taking a longer time to learn just need a lot of creativity in terms of accommodations and modifications. And we need to treat our interventions as educational opportunities as opposed to pure disciplinary or punitive responses. We talk a lot about tiered systems of supports, and for those students who may have continued difficulties or maybe intentional refusals around wearing a mask or washing their hands or keeping distance. So we have provided guidance to the schools about integrating COVID-related health and safety expectations into their system of interventions and supports, and how to build the layers or the tiers of interventions so that there are certain responses and supports for all students. There are some, you know, more comprehensive interventions for those few that are struggling, and then some intensive supports for the rare occasion where we have students that it's just not working for. I just wanted to say a word or two about restraints and seclusions. Again, restraints and seclusions are emergency interventions. They are not, they're not planned interventions. They're to be used only when a student poses an imminent and substantial risk of physical harm. Our rules state that, that seclusion is prohibited unless physical restraint is contraindicated. So in other words, the rule states that physical restraint is actually the preferred intervention. It's considered less restrictive. But in partnership with the Department of Health, we have determined that for this time in our history, we're reversing that. And we are saying that restraint is contraindicated, just given the fact that we're not able to physically distance when we're restraining a child. And in some cases, in a lot of cases, a mask, we're advising that it might be helpful to take the mask off before you restrain a student, just so that they don't have any restrictions on breathing or in case it were to be tangled. So that's why we're saying that restraint is contraindicated. We are not going so far to say that it's prohibited. And what we're doing here is we're giving some flexibility to everyone so that you can use seclusions in instances where you may have used just restraints in the past. And what we're saying is that you need to work with your teams, work with your families, work with the students, most importantly, work with your school nurse and your COVID coordinator to determine whether and under what circumstances the risk of harm outweighs the risk of spread of infection. That's a lot, but I'm going to turn it over to Katy now. Next slide.
All right, can everybody see me and hear me? My name is Katy Langevin. I'm the coordinator of instructional strategies with the AOE. So I'm going to go quickly through the couple of guidance documents that I have. The first one that we did was on evaluations. So psychological evaluations are rigorously tested for reliability and validity, and they're done so in very particular circumstances. So a lot of what we talk about in the evaluations guidance is just that you can't be performing evaluations that were not tested under those same circumstances. So for example, if you have an evaluation that's only been tested for reliability and validity when done in person, then you can't do it virtually. So the document really talks a lot about how you can do evaluations, what the considerations for those need to be. You need to think about privacy. You know, is the student going to behave differently because there are parents in the house? You need to think about PPE. Are there students who are super uncomfortable wearing their mask and so they're not performing at their highest level? Or are there students who are afraid of the PPE maybe that the evaluator is wearing? So the evaluation guidance is just kind of encompassing all of those things to think about, and it's linked at the bottom. Next. And then the next two documents are hygiene and toileting. The hygiene document outlines strategies and considerations, both for teachers and for parents. I think a lot of the guidance in there is actually more for parents, more for at-home use than it is for teachers, although teachers hopefully are helping to instruct parents on how to do some of these things at home. So in this document, we're talking about masking, we're talking about hand washing, we're talking about travel throughout the school, cleaning. I know we don't have a lot of time to get into it, but I hope that you will check the document out because it does have a lot of helpful information. And I even tried to level some of it. So, you know, kids with the most severe sensory issues going to less severe. I was an autism consultant before I worked at the AOE, so there's a lot of autism specific guidance in there. I know we got a question about that hopefully we'll have time to answer later. And the second document is about toileting. It's really just an outline of the safe toileting practices within the school. The guidance was not out at the time of the slides, so I'm linking it in the chat for anyone who would like to look at it because it has since come out. And I know we're super out of time, so let me pass it on to Ernie.
And just as Ernie is coming on, I just, if folks have a question that they want to put into the chat box, if you could share it to all panelists and all attendees, and then that we can be able to share it with everybody as we go along. Ernie?
Good afternoon. This is Ernie Wheeler. I've been with the agency now. I just celebrated my 20th anniversary a couple weeks ago of coming to the AOE. I work for them part-time. I'm mostly doing educational surrogate parent work, but I also handle some of the TA calls and emails that come in. So here are some sample questions and answers that I've had recently. Number one, if a parent chooses to homeschool their child, what can they do to obtain special education services? As was said previously, a parent loses their special education rights when they choose to homeschool their child, but a parent may apply for a services plan with their school, and it's a matter of contacting the school district, the director of special education, and negotiating that services plan. Again, home study students do not have a guaranteed right to special education services, and the proportional share of funds that districts have to serve those types of students is based on last year's count. And so that's going to be a limited amount of money that they have based on the fact that more people are now opting to do home study. Next slide. If a parent chooses full remote learning, can they ask for services at home? The question here is, the answer here is, currently schools are not required to offer in-person services at home. Services may be provided remotely if appropriate. If parents want in-home services, again, that's done on a case-by-case basis. Contact your school, have a discussion with the IEP team. Again, we're not requiring that anyone provides the in-home service at this point, but there may be options out there for districts or other agencies that provide in-home services. Next slide. If a parent wants more in-person service days than are being offered, what should they do? This is the situation where a school is offering 2 days a week, and there are another 2 days a week where some other kids come into the school. Parents should contact their director of special education or request a meeting of the IEP team to discuss those additional in-person days. And again, it should be done on a case-by-case basis. There shouldn't be a blanket decision that voids having that discussion. And I think that's my 3. So I'll pass this on now to our colleagues in health.
Great. Hi, everybody. I'm Jill Rinehart. I'm a pediatrician in Burlington, recently joining the University of Vermont Children's Hospital and the immediate past president for Academy of Pediatrics. And I'm joined by Monica Ogelby today. And I'll start with the first slide, if you don't mind changing the slide. So I've been a part of this wonderfully vibrant discussion on how to get all of our kids back to school. And I think one of the things as a pediatrician we want to emphasize is the importance of getting our kids back where we know that overall they do well. Together with the colleagues here on this panel, we put together some guiding principles about educating kids with special health care needs, really highlighting the importance of collaboration and communication amongst the multidisciplinary team, all the decision-making from the approach to days in school to addressing and responding to that unique need of that student. And so families and students are really respected as part of the valuable team contributors that you are. We also want students to have access and to participate in specialized instruction to the fullest extent possible, given their individualized needs. One of the questions that we keep coming up is, what if what the school offers is not meeting their access needs to education? Remote learning isn't for every brain, right? And we want kids with special needs to be offered equitable educational opportunities comparable to their same aged peers. These are fundamentals of how we go about planning for these kids. And we hope that schools will be flexible in their educational approach, but at the same time recognizing their current educational model is limited because of this pandemic. Can I have the next slide? Oops. So another collaborative put together and all these things can be found on a Vermont Department of Health website is we've had a lot of questions in the medical home community about mask exemptions for children and adolescents. Ultimately, what we'd like to suggest is that mask exemptions really need to be made by the team that includes the student and family, the medical home, the school nurse, or other subspecialty team if you're uncertain. And that we really feel that additional documentation from the medical home, pediatrician, et cetera, isn't really necessary, given that children with special healthcare needs usually already have an IEP or a 504 in place with the diagnosis that then might exempt them. We're really trying to limit the burden on medical homes, but also collaborate verbally and with one another around the medical home and schools together. There are some developmental behavioral conditions that make wearing a mask unsafe for kids, but they're pretty rare. Essentially, if a child is unable to wear a mask safely for most of the, for a medical reason, it's the same reason that they probably shouldn't be attending school in person. But the disorders that can impact and that we are having these conversations around primarily are youth with developmental delays, those with limited physical mobility, severe autism, can't tolerate a mask, and some structural abnormalities of the head and neck, although some of those children can be able to wear a sort of bandana style coverings. A couple highlights on the mask exemption document that I thought would be useful to share with all of you is really thinking about that although a child may not be able to tolerate a mask today or on September 8th, that incorporating a plan to get them to become more tolerant of wearing the mask could be really helpful and is sort of an expectation. As a primary care pediatrician in the medical home, I've had many opportunities as people have been planning and having IEP meetings, and we have care conferences when there's a lot of medical complexity too. I've just been overwhelmingly surprised by the patients that do tolerate masks that I may not have thought because of their severe autism or another need that that they may not be able to tolerate them, but they certainly have been. And the second thing on mask exemptions that I thought was important is for those kids who can't take masks off or put masks on themselves. There are some states who say, you know, that's like a no-brainer. We shouldn't even be putting those masks on. What we've discussed, because many youth with disabilities who can't put their mask on, they want their mask on at school too. It's just whoever the individual is that's keeping an eye on their other health needs, be mindful of that mask and making sure that it's not obstructing their eyes or other things or airway, etc. So having someone attend to that mask as they would the rest of the child or youth would be important. The next slide. Thank you. So obviously there's been a lot of challenges in accessing education. And I do want to recognize that there is this vibrant and important conversation happening in our country now about racial justice and health inequities. And I feel like this is an issue of equity for our kids with special health care needs right now. That's very real. And so schools often, or families are feeling like schools are telling them that their students with IEP have to choose one type of plan, and that may or may not meet their accessibility needs. That regression is absolutely real and has been happening with families, and that families aren't necessarily doing well with that. And we're very concerned as pediatricians, as you are, as community members as well, about the health of our families due to the pandemic. Obviously, things like physical therapy, OT, and speech and applied behavior analysis are not effective remotely for many students. There are medical complexities that make it challenging for kids to attend schools. I think there's this perceived belief that kids with special health needs have an extra vulnerability to the disease of COVID itself. We talked about masks and exemptions, and I think there's a lot of fear, not necessarily facts, that are driving some of our feelings and emotions around getting back to school. Monica, I'll pass it on to you.
And of course, there's been a lot of opportunity here as well. My name is Monica Ogelby. I'm one of the CSHN. I'm the CSHN director. I'm part of the health department, and I'm a nurse. That's my background. So tons of opportunities. We're seeing an increase in IEP meetings right now. This is the start of the school year. So this is when we're seeing those multidisciplinary teams get together and connect. And of course, we're actually seeing that sometimes these types of meetings are feeling a bit more accessible for some families and the students and the educators, because we are able to leverage things like telemedicine and teleeducation and just telemeeting for these types of gatherings that are so important. So we're hopeful that using things like Zoom meetings, or maybe something that continue, so that families, if it makes it more accessible for them to attend these types of IEP meetings or do regular check-ins, that using this type of technology isn't something that we completely lose. I'm sure we'd like to do more in person soon, but in the interim, this is a really nice and convenient platform to use for a lot of families, and we shouldn't lose sight of that. So it's easier for the team to get together. We've also seen with some families that children have really thrived in this environment. Certainly not universal for all of our children and all of our kids with special health needs. But for some children where we've seen the school environment be incredibly stressful for whatever reason that is, there are some kids who have done really, really well in this environment. So we want to be able to make sure that we're creating space to learn how different children with different special health needs are actually doing well in different environments. Now that we're testing them out, we're having opportunities to observe our children in a whole new educational environment. And so we want to make sure that we're using this as a place to really see how children with can thrive and really maximize their strengths and energy in their education. And then, of course, we've really created a lot of strong connections between our school nurse system, our medical home system, our educators, special educators through this, just by virtue of the fact that we've had to. And we're all really hopeful that we can continue collaborating really closely moving forward. And when the dust settles, that we can continue to really improve the system of care for kids and youth with special health needs, especially as it relates to school. Slide, please. So this is an infographic that we drafted that I think really speaks to a lot of the points that many of the other presenters have talked about. Really the key tenets of this work being a multidisciplinary approach with the school team, definitely including the child or youth at all opportunities and segues possible, so that they can use their voice and give us their opinions, because we know they have them. Making sure that we're really including the medical piece here, like really what is our health concern here? As Jill spoke to, many children and youth with special health needs are not as vulnerable to COVID-19 as we might be worried that they are, and it's good to be diligent, but certainly a lot of them can be in school in person, which is awesome. That's where we want them if that's where they want to be. We might have to be thinking about transportation, communication, their social emotional behavior support, their development in thinking about mask wearing or accessing education. Certainly the physical environment. I think about the physical environment a lot. We've heard from quite a few people across the state who have said, how come there's not just sort of blanket guidance of how things should look in each school? Because the physical environment of each school is incredibly unique. And to do that might actually be really tampering down a school's ability to be creative, use outdoor space.
Monica, I'm just going to give you the 5 minutes.
Thanks. Awesome. Thanks, Sarah. So we really want to make sure that schools actually have the flexibility to be creative, and we've seen that happen. So really thinking about that physical space within the school. And then of course, academics. I think, a few people have said it really beautifully in terms of like being patient, being kind to ourselves. Obviously academics are important. I think, I'm a parent too, like the social, emotional, and well-being of ourselves and our kids is really important here too. So it didn't mean to put that on the on the end of the spectrum here of supports and things to think about, but certainly like we want to get there, and we will get there as well. Jill, before I move on, do you have anything to add there? You want me to head to the next slide?
I think just to reiterate that two children with the same medical diagnoses can have very different plans, as we all know, based on all your different needs in these categories.
Thank you.
Yeah.
Slide. Next one. Last one. All right. And so some suggestions. Quite honestly, a lot of these suggestions have already been brought up here in this conversation, which is great to see that we're so aligned. Can't stress enough the idea of making a plan with your team. If you haven't gotten together with your team at school, let's do it. Now is the opportunity, and include that school nurse and ask your pediatrician to be there. They really want to be there. And then let's think outside the box. Are there opportunities to access some services in the home? Are there alternatives to the cloth facial coverings that we're recommending students wear? I saw a question in the chat box that I know we will get to. There's lots of face mask questions and we'll get there. But certainly, like, there are opportunities to consider alternative PPE options, but it all goes back to that multidisciplinary team, getting together with your pediatrician, with your specialists, with your child, with your educators, and really determining what's best for that child. There's no one size fits all ever, and certainly not during the face of a pandemic. And then revisit that plan. Whatever you decide right now, what's best for you, what's best for your children, might not be what's best in a week or in 2 weeks or in 3 weeks. So allow yourself to be nimble, allow there to be some changing of minds. It's going to happen. And continue to, touch base with your team and make sure that what's working for you then is still working for you and your student and your loved one now. So last slide, handful of recommendations or resources here. So that guidance that we talked about in terms of mask exemptions is here. And then also some basic information about mask wearing in the face of COVID.
Hey everyone, my name is Rachel Seelig. I'm a staff attorney in the Disability Law Project at Vermont Legal Aid. And my little chunk of the presentation here today is called Everything Has Changed and Nothing Has Changed. And the reason for that is our education system has absolutely fundamentally changed in terms of how our classrooms look and our schools look and options for remote learning. But when I mean nothing has changed, next slide please. What I mean is that the special education laws are still on the books exactly as they were before the pandemic started. So all of the rights that parents and students have had are still in place. And in fact, Congress thought about changing special education laws, gave the Department of Education at the federal level the opportunity to ask for changes. And everyone decided not to change the law. That what we need to do is, when our schools are open, make every effort to fully implement IEPs and 504 plans, and make sure that we meet when schools have been closed to decide whether students need what we call compensatory education because of changes in terms of what they got while schools were closed. Because the Special Education Law, the IDEA, the Individuals with Disabilities Education Act, has not changed, that also means that the court cases that have interpreted that law are still on the books and are still good law, and what we look to decide if a student has been denied their rights under the special education law or not. So we've talked about a lot of these topics already. I'm going to kind of go through them quickly. Students still have a right to a free, appropriate public education based on an individualized education program in the least restrictive environment appropriate to the student, after appropriate evaluation, with parent and student participation, and with procedural safeguards and student confidentiality. Next slide, please. So, we've talked a lot already in this first hour about, working with the IEP team, communicating, asking the team if you think there need to be changes, listening to the team if folks at school think there need to be changes. And I completely agree with that. If problems can be solved at the team level, that is the way to go. And so that should always be the first place to go. And sometimes you do need to bring in folks who aren't necessarily part of the team every single meeting, whether it's a pediatrician or a therapist or another specialist. But if that doesn't work, it's important to know what the law says about what FAPE is and what your rights are if you do need to go beyond the team to try and get your child what they need. So FAPE, which is, again, that's the acronym for Free Appropriate Public Education. It means the special education and related services that a student with disabilities receives at public expense in a way that meet the standards of the State Education Agency, or SEA, and in conformity with an IEP and with the requirements of Part B of the Special Education Law. That special education, that's the specially designed instruction that is designed to meet the unique needs of the child so that they can, as other folks have talked about, have access to the general education curriculum. Because all of our students are general education students, and some of our students are also special education students. It also includes related services that, like transportation and supportive, corrective, and developmental services. That might be speech or therapy or occupational therapy or physical therapy, or one of the ones Jackie mentioned, parent counseling and training, that enable a child to benefit from the special education, which again, the special education enables them access to the general education. So that's how the law defines FAPE. Now, this leaves a lot of room for questions. Well, what about this situation? What about that situation? So if we can go to the next slide, please. There have been a couple of major decisions that were decided by the United States Supreme Court that help us understand where are some of those boundary lines. So one of the cases that's kind of a benchmark case for us is a case called Rowley. This was a case in the early 1980s for a young girl named Amy Rowley, who is deaf and who was asking for an interpreter, an ASL interpreter in her classroom. And the school didn't provide it, and so her parents appealed, and you can appeal these IEP team decisions all the way to the Supreme Court if you have to. Generally not something I recommend, but that's how important these rights are, that you do have that whole level of relief. So what the court decided in Amy Rowley's case is that when we're talking about FAPE, we're talking about specialized instruction and supportive services that confer some educational benefit. And for a student like Amy, who was in a general education classroom throughout her day, those services need to be reasonably calculated to enable advancement with passing grades when the student is in the regular classroom. And again, those requirements about being a public expense, meeting state standards, and consistent with an IEP, the court reaffirmed all of that's in the law, that's still true. So this case was kind of the law of the land for a long time, and yet unfortunately, the question of what is some educational benefit remained. And this is actually an important question in the time of COVID as well. Next slide. Oh, back one, please. Thank you. So just a couple years ago, another major special education case came back to the United States Supreme Court. And this case is known as Andrew F. Now in this case, Andrew was a young boy who has autism and had been in public school for a number of years and not made progress on his goals and had severe behavioral support needs. And so eventually his parents pulled him out of school, placed him in a private school, and then asked his school district to pay for that. And the district said no, and again, his case went all the way up to the Supreme Court. And so Andrew's case is a little different than Amy's case because she was in a general education classroom, whereas Andrew was really not able to be in a general education classroom. So the court was looking at a slightly different issue. But they also addressed this question from Amy's case of, well, how much educational benefit is enough? And they didn't help us a lot. They said any is not enough. But they also explained that when we're talking about making progress, what we're looking for is that the IEP is written so that the student is reasonably calculated to enable a child to make progress appropriate in light of the child's circumstances. So again, an IEP has to be reasonable. It doesn't have to be the best. It doesn't have to be ideal, but it does have to be targeted to allow the child to make progress appropriate in light of the child's circumstances. Next slide, please. So the court drew an analogy. So for students who are in the regular classroom, their services should be targeted to allow them to make progress in advancing from grade to grade with passing grades. That's appropriately ambitious for most kids in the general education classroom. For students who can't be in the general education classroom, we want goals that maybe are different, that maybe not grade level advancement, but that allow our students to meet challenging objectives. Next slide. So with all of that, in the time of COVID, there have been a lot of questions about, well, does COVID change what a FAPE is when my child has received a FAPE. And it's a little early to know exactly what courts are going to say about that. But so far, a lot of court and administrative decisions are finding that if students received less services because of COVID, and those students therefore did not make the meaningful progress that we would have expected had they received those services, that they should receive compensatory education. So we've got a couple of administrative complaint decisions out of California and Colorado that made that conclusion. There's also a recent district court case in New York where a family had already been litigating their child's access to FAPE for a long time. The court had made a decision. COVID hit, the decision was not implemented. The decision required in-person supports to be provided, and so the family went back to court, and the court said, no, the education agency in New York needs to find a way, even with social distancing restrictions, to provide in-person supports to this child. So all of that is to say that, you know, our perspective is no, what a child's right to FAPE has not changed, that those services and supports that are needed to access the general education curriculum, that is still the standard. Now, general education process looks a little different right now. So some students are getting general education entirely remotely, and others are getting it in a hybrid model, and others are getting it in person. And so the services and supports to allow access to that general education curriculum may actually be different. They may be more. The student might need more services and supports because they're at home than they would have needed at school, or vice versa. They may need more services and supports to be in school because of some of the things we've talked about in terms of masks and behavior and washing hands than they would need if they were at home. But students shouldn't.
Can you give me 5 minutes?
Thank you. Students should not be excluded from any of the options that their non-disabled peers have just because of their disability. We need to be looking at what are the supports we can put in place to ensure that accessibility. And if those supports aren't put in place, again, the first thing I would recommend is go back to the IEP team, ask for those services to get put in place. Next slide, please. So here are a couple of the issues that we've been hearing about so far as COVID has continued. We've heard about IEP services only being offered on in-person days, refusal to add additional in-person days, delaying evaluations because of COVID without having kind of a student-related reason to delay the evaluation, refusing to provide in-person homebound instruction because of COVID, teams seeking just consent for a change to the IEP without having a meeting, and contingency planning where there would automatically be a reduction in services if the student goes remote. All of these raise different concerns. And again, my first recommendation is always go to the team, explain why something different is needed. And if that doesn't work, seek support from Vermont Family Network or the Agency of Education or us in the Disability Law Project at Legal Aid to get some advice, or, you know, talking to a pediatrician or a therapist or some other professional who knows your child about kind of helping explain to the school team why something different is needed. You know, Ernie talked about, you know, a family who chose remote option and could they get an in-person person in their home. And I think kind of there's so many subtleties to these kinds of things. And I think there is a difference between choosing the remote option versus a student being placed on a homebound placement because of a medical condition. And if that medical condition also means they're not going to be able to access virtual remote instruction, the team does need to meet and figure out, well, how do we provide them services? Because we can't just throw up our hands and say, well, I can't do anything. Next slide. So one of the keys here really is know your rights. You don't have to agree with every proposed change that a school has to offer. A school doesn't have to agree with every proposed change you have to offer. But you do have the right to have IEP meetings at your request, for those meetings to be scheduled in a reasonable time and at a time that's convenient for you and for the other members of the team. You have the right to request additional services and supports. And that includes assistive technology. And that might even be assistive technology your child didn't need when they were in person, but they do need when they're remote. And you have the right to have all IEP team members present. Monica talked about this, I think, in a really useful way, right? Like a lot of our students with special health needs and disabilities do have a multidisciplinary team. And, you know, the coordination that's needed now because things are harder is as important as ever. And so if somebody can't attend, it maybe will make sense to reschedule so that everyone can be on the same page. You have the right to a prior written notice. So again, the goal of the team is to get everybody on board and everyone to agree. But if that's not possible, the school district will make a decision and they need to give you that decision in writing. And having that in advance of the decision is important when we get to talking briefly about dispute resolution options. And you have the right for your child to have an individualized education program. Decisions cannot be made based on blanket policies. And if you disagree with a decision, say so. Make sure it's recorded in the minutes. That's something Karen talked about kind of at the top of our hour here. Now, part of why you want to say so and make sure it's recorded, part of why you want to get a prior written notice is that if you can't work things out within the IEP team, you do have dispute resolution options available as part of your procedural safeguards. You can ask for a mediation where you bring in a neutral third party in order to try and help you work out the disagreement that you have with the school team. You can file an administrative complaint where you ask the Agency of Education to start an investigation where you believe some of the rules for special education have been violated. And you have the right to file for due process. And that means going to a hearing officer and saying, I believe, and here's the evidence that I have, that my child did not receive a free, appropriate public education. And therefore, I need you to make an order and give me some relief. And one of the things that's important to know about due process is there's a right that's attached to it called invoking stay put. So if there's a plan to be fundamentally or even somewhat changing your child's placement, if you file due process and invoke stay put, they have to stay in their existing placement until that case is resolved. And that's part of why knowing about a change ahead of time is so important, because if the change has been made, then you're not going to be able to hold on to that. Next slide. Even if you don't use those dispute resolution options, we've got a couple additional recommendations. This is definitely a year for everyone to really be on top of what's in the IEP. Are the present levels of performance accurate? If your child didn't progress or regressed last winter and spring, those sections of their IEP may need to be updated. And that may then reflect changes in goals and services in order to get them back to where their present levels were and then make the progress we wanted them to make. Are goals being measured objectively? Can everyone sit down and look at the same information and understand what the progress is your child has made? Are the goals challenging and relevant? And are the types of service, the amount, the duration, the provider, are those consistent with past IEPs? Or with changes you know you've agreed to. And last, I want to make sure that you know you can monitor your child's progress too. You don't just have to listen to the school team. You can, you know, this is maybe even an easier time to know what services are being delivered because you're there with your child while they're learning remotely. And you can both request the records the school is using to track progress because you have the right to your students' records. And you can keep track of your own understanding of their progress and bring that to the team. And if their services are not delivered and they're not making progress or their services are not delivered accessibly, go ahead and request compensatory education. Compensatory education can be the remedy that you get out of a due process case or an administrative complaint, but both of those things take time and energy for everyone. And so if the whole team acknowledges, you're right, we didn't deliver the services, the child didn't make progress, why go through all of that? Like the team can essentially, before filing a complaint, come up with a settlement to figure out compensatory education. And so I think it's important for teams to be having those conversations. Next slide. So I know we've had a lot of questions in the chat, and I think Sarah's going to be presenting those to all of us on the panel today. But if you are looking for advice about your child's specific situation and rights, you can always call Vermont Legal Aid, and our contact information is on the screen. And these slides will be made available after today's presentation.
Great, thanks, Rachel. And thanks to all of our panelists. We're going to move on to questions and answer, and we have quite a few of them in our chat box, so we'll get right to it. We did get some questions submitted ahead of time. Our panelists have reviewed them, and I'm going to give you the first one we have modified slightly, but it's, what is, I'm sorry, you know my chat box. What is offered by this, if the school doesn't meet the child's accessibility needs, what do families need to do? And Rachel, maybe we'll start with you and then any panelists who want to chime in.
Sure. So I think, as I was saying, the first thing I would do is go to the team and explain why what's being offered isn't meeting that child's needs. Make suggestions about what you think could help meet those child's needs. Bring in outside experts if you feel like you need someone else who has knowledge of the child to help you do that. And if that doesn't work, again, the resources that we all have presented today, Vermont Family Network, Legal Aid, the Agency of Education, are all available to kind of help you figure out next steps if the team approach has not been successful in terms of getting that accessibility.
Okay, I'm going to move on to our next question. I'm sorry, I'm having a little bit of trouble with my chat function. How can students who, because of the nature of their disability, cannot keep a mask on, for example, severe ASD, and won't even wear a hat in the winter, continue to have their needs met at school? Parents would like their children included, but are being told that because they cannot keep the mask on, that they'll be isolated in separate rooms with their paras. This does not allow them to go and work on their social goals. Whoever would like to jump in.
So I addressed this a little bit in the comment, but just remembering that masks aren't the only piece of what's keeping kids safe right now, that distancing is a big part of it too. So an unmasked child in a room with other children who are masked is not going to be at risk to those masked kids. So and really trying to keep flexibility around that. I know there was some discussion about people getting so black and white about 6 feet on average versus 3 feet on average and all of that. And really, you know, we're just trying not to get hung up on the micro piece of this, but what's best for everybody overall. If anyone has any other things to comment on that. We do have things that are helping, like symptom screening before kids go to school, and the outdoor classrooms that hopefully we can keep up as long as possible. They all benefit from that. And that's one piece I think that's been clear as we have this discussion, that if we can get this right for this population of kids, this is what parents tell me all the time, we'll get this right for everybody.
Yeah, I agree too. And this is what I was speaking to when I talked about layers, multi-tiered layers of support and getting creative. You know, it's up to us and in the schools to really just work with those students, help them. And if they can't tolerate a cloth mask, there are alternatives. You know, we can have different varieties of masks on hand. We can create distance, like Jill said. You know, that's part of the school's job, is to work with that child, just as we would work with them if they were having trouble with their math problems.
Great. We'll move on to our next question. This is for you, Karen, I think. I'm just wondering why students are not invited to the IEP meetings. This is because in the presentation.
Okay. Yeah, I think you froze for a second there, Sarah.
Oh, that happens a lot here.
But so I heard most of the question, but absolutely a student should be a participant on the IEP team when they are mature enough and ready to attend. I had focused on the parent role, but definitely students should be involved. And of course, especially when they are at that transition age and are looking at life beyond high school.
Great. So this question is wondering about parents who, because of health issues, have to do remote schooling and would like to be hired or compensated as their child's one-on-one. These children have a definite need documented in the IEP for one-on-one. For example, they might have an intellectual disability such as Down syndrome. Is this a possibility for this school to do?
I
I
can
think the
start.
question,
Yes. Oh, go ahead, Ernie. Go
Okay.
ahead, and if I have anything to add.
Yeah,
I will.
I think the question there becomes whether or not it's going to be federally allowed as a reimbursement opportunity, or even state allowed as a reimbursement opportunity for special ed services. And once that decision's made, then it'll go out to schools. But right now, we don't have a mechanism for reimbursing schools for that service, as far as I know.
We, through experience, have had parents who have become paraeducators, and then in this COVID world are continuing to be their paraeducator, but that would be the workaround.
But they would need to be hired by the school district.
Yeah.
Right.
Yeah, and also, I mean, to be frank too, in Vermont, there is no voucher program where the money follows the student, with the exception of pre-K. There are other pieces in place. In some cases, for a parent to be paid by the district outside of transportation as a related service, they would have to become a district employee or contractor subject to fingerprinting and requirements to avoid conflict of interest, nepotism, a variety of things. So this is a very complicated question. It's very interesting, and there really hasn't been a national conversation regarding this issue.
I would just add, I think it also still comes down to what does this child need in terms of accessing their education. And so if some of those logistics can be met, that the parent meets all of the requirements to be a paraeducator, that the district is willing to hire the parent, I think I don't think you can take the fact that it's complicated to say, no, you can't do it, right? Like if that is what the child needs, discuss it with the team, see what you can figure out. I think that if that's the only way for the child to receive their free appropriate public education, we're not going to give up on giving them that faith just because that happens to be hard.
I did get this question. It was one of the questions in the chat too about home access to paraeducation in general. And in many of the school teams that I've been a part of, that actually seems like a good solution. They have a para, it limits the para's contact to a smaller group of kids, even though it might be in the home, that could be distributed more evenly throughout the week. Is that something that's been talked about amongst the school teams? Sort of having paraeducators go to students' homes?
Yeah, it is talked about, and it comes down to being a local decision, and it's based on a variety of factors. It's those factors being, do we have the ability to supervise that paraprofessional? That's a very important part of the overall package of having a paraprofessional. It also depends on, there's just a lot of factors, but, bring it to the table, ask for a meeting, discuss it, bring it to the table.
And one of the positives, again, through the pandemic, I have a colleague who is a behavioral interventionist, and she supervises people who are doing direct service behavioral intervention. And so as a supervisor, she's been able to go into the homes virtually with an iPad and not be another physical presence in the room while the person is actually doing the behavior. And it's been kind of a positive thing. And I wonder if that might be another opportunity.
Yeah. None of the rules were written for COVID-19 pandemic. So we're, this is uncharted territory, and, we've got to figure it out.
I think to Rachel's point, the concern that I think that raises the most controversy for families is when families are told, we don't do that at our school, or this isn't how we do it, or we don't have that community program here, so we don't do it. And it's, again, it's still within your right to ask, is what you're saying. And
yeah, it's absolutely still within your right to ask, and you should ask, because again, you know, we don't do prepackaged special education, right? We do individualized education programs. And so if that individualization is what this child needs, then the question isn't, do we do it? The question is, how do we do it? And it might be with school staff, it might be contracting with an outside provider, it might be through a 264 plan where you're coordinating with another service provider. So there's lots of different solutions that we have to try to work around the challenges that COVID has created for us.
Us to our next question is, does Medicaid fund parent counseling training if it is included in the child's IEP? And does that change based on the parent's insurance?
It's an IDEA covered related service. So I don't think whether a child has Medicaid or not would affect their ability to a parent's ability to receive parent training information. But Monica, you may know better about whether it's also something that could be in some way covered by EPSDT and Medicaid.
That's a really good question. I do not have experience with parent training and counseling being paid for by Medicaid under EPSDT, just for the beneficiary themselves. So the child or youth less than 21. But obviously the training is to support the child and youth. So that's a really interesting question that I might ask to make a note of and then get back to the team about. It's a great question. Thank you.
And I can say that, you know, parent training and counseling is a related service. Therefore, it's an allowable cost under the IDEA Part B.
Yeah. And as far as insurance is concerned, I mean, if you were to compare it to a child who needs physical therapy as opposed to behavioral therapy, you know, the school pays, Medicaid pays, it gets figured out.
So our next question is, what services are students who opted for VT/VLC entitled to, and how do they receive them?
I mean, I'll respond to that. For somebody who's posing that question, if they want to send that ahead to the Agency of Education, this is something that we're unpacking now as we're, you know, getting the full, you know, understanding of the type of the number and nature of supports and services that come with that virtual and distance learning community. So if they want to send that directly, we'd be happy to look into that for them.
That'd be great. I think our next question has somewhat been answered, but must students all wear cloth masks? Students with speech needs may be hampered. Could they wear shields instead?
Yeah, and there are masks that are partially cloth and then have a clear plastic pane. Yeah, that's what I meant by creativity and options, accommodations.
Great. Here's another one on masks. Can the school district prohibit kids from attending class with other kids if it's baptism? The Harwood Union District has made this decision. I am not clear if we are able to seek an exemption.
I think that's one of those examples where it would be worthwhile convening the team, because that's really a team-based decision. And as Jill referenced earlier, exemptions are a thing and they are allowable under certain circumstances, but it's a decision made by the team. And if it would be helpful to have, you know, the pediatrician or a specialist weigh in on that decision-making process, by all means. But generally speaking, the back to school guidance does not state that a children under no circumstance, you know, under the words on Friday, they don't come out anymore, but it doesn't say that kids absolutely have to wear a mask in order to attend school. It's obviously a really strong recommendation, but what we're trying to get there from a health perspective is economy of scale. So obviously the more people in the school that are practicing distancing, that are wearing cloth facial coverings or masks, a little nuance there, so I'm trying to practice the language, the entire community is going to be safer. So obviously we want everybody to try that, make that your baseline practice, but if it doesn't work, let's not let that be a barrier to accessing education.
I think
Right.
that also raises the ADA issue, right? Schools are also covered by the Americans with Disabilities Act. And so IEPs all have a section on accommodations. That's what 504 plans do as well. But fundamentally, if there are no exceptions or reasonable accommodations being made, given the guidance that's come out that exceptions can be made, that would be a concern for me about a district violating multiple federal laws.
Yeah, my response was going to be very similar to that, in that I don't think you can make a blanket policy in a world where individual needs need to be met. And so it's a matter, it's a case by case basis of what can we do to modify or create a situation where that child can be included.
Great. I'll move us to our next question. At what point do the risks to others outweigh providing in-person services to students? And the example given is a young student who is unable to tolerate a mask due to developmental disability, runs around class, puts items in mouth, spits them out, touching face and secretions, and touching items around the classroom. Behavioral plans being implemented to try to manage this behavior, but it is ongoing for now. Any additional thoughts?
I just have to say that's a pretty common scenario. I just want you to know, right? At least in my world, and it's a tough one. But to my ear, it sounds like the behavioral piece of that needs to be stronger and more improved.
Okay.
But I'll ask the educators to comment.
Well, there's a follow-up also. How is FAPE affected if a student is not allowed to have access to peer engagement? So folks have some ideas around that.
I think it depends on whether that peer engagement is part of the student's IEP goals and how that peer engagement is part of their access to the general education curriculum. So with everything, it's a question of how, for the individualized child, what are their needs? And if the way that they have had that peer engagement in the past is not currently possible because they're remote, how do we find alternatives so that they can have that peer engagement and work on social goals? I imagine Tracy or Katy have thoughts on that too.
Yeah, Katy, you want to take a stab on it? At it?
Sure. Yeah, I would say that, like everyone has said, every child is completely different. Their needs are completely different. They learn in different ways. Every school building is different. The ventilation is different. I mean, there's so many factors that need to be taken into consideration. But there are other ways to have meaningful peer engagement other than in person if that's not going to work. So there are plenty of ways to facilitate an online engagement. Maybe, teachers can set up with a peer buddy. And if that student, say, has a special interest, maybe that can be the first kind of topic that they broach, just sort of, get into it slowly. There are other ways to have that sort of peer-on-peer interaction if that in person isn't working. But again, like everyone has said, there's a lot of different ways that we can try to make it work. We just have to be creative.
Okay. I think this question came in, Rachel, when you were speaking. Does Vermont have the workforce capacity to meet these needs? And what do we do if they do not?
I think we're still figuring out if we have the workforce capacity to meet these needs. I think that's a question we don't actually have the answer to right now. In addition to our students with disabilities having unique needs, we have a lot of educators and school staff who have disabilities and are having to make individual decisions about their ability to continue in-person employment or can they get remote employment. So I think we don't know yet. And I think that workforce development is also something that's well within the purview of the Agency of Education in terms of thinking about that pipeline. So they maybe have an answer to that question too.
No, I would echo what Rachel is saying. This is something that we're trying to get a pulse on. We're interacting frequently with our districts, with our district administrators to find out how many SLPs we have, how many paras we have, how many people are doing early retirement, or how many took a leave of absence as a result of COVID. So this is information that we are compiling and we're very concerned about. Special education is a national critical shortage area. It was a concern before the pandemic across all states. But that is something that we continue to monitor. We also continue to look for outside resources at the national level, grant support, other opportunities to address the shortage area across special education and related services. So it's very much on our mind, but we don't have a hard number to be able to share at this time.
Okay. So what if a student finds on learning a mode of learning they simply refuse or cannot engage in and it doesn't work for them? Anybody have thoughts on that?
Very similar to thought to something we have been talking about throughout this, which is the team needs to convene. The team needs to discuss what's not working about that remote environment and what are the alternatives. You know, if the child is remote because they're medically homebound, that kind of gets to that question of, well, do they then need in-person in the home, and how do we make that happen? If they're not medically homebound and there's an option to move to a hybrid or an in-person model, then the team should consider that as well. And the team should consider, are there other services and supports we can use to help the child be able to access the remote model? Because again, we don't want to take the same options away from students with disabilities that students without disabilities have.
Yeah, we can't stress enough that individualized, unique needs of the students need to be at the forefront of that conversation. And there's also no limitation in how many IEP meetings a year there are. I mean, that's another misconception, or even a length of time in some cases. You know, these things need to be, you know, considered carefully with the individual needs at the forefront, and it's going to take careful collaboration with everybody. So always, you know, go to that director, call that team meeting if you need to, but have those critical conversations and problem-solving opportunities as a team.
For some teams, it works really well to have pre-scheduled monthly meetings or every 6-week or every 8-week meetings, so that it's on everyone's calendar and you can get everyone there. For other teams, something's going to pop up and you're not going to know ahead of time, but we need to meet now. And so that's, you know, scheduling can help, but flexibility is important too.
Try and take a couple more questions. If a child was denied access to general education last year during remote learning, but still checked in with his SLP, OT, PT, and special educator once per week, would he be eligible for compensatory services, the COVID comp services?
It depends. We look at a couple things for compensatory education. We look at, did the student not receive services? And it sounds like in that situation, they didn't receive all of their services. And then we look at, did the child make progress? Did they stagnate? Did they regress? And so I think it doesn't hurt if the child didn't make the progress we expected them to, if they'd gotten all those services, to request compensatory education.
Great. So I'm going to wrap up with one last question. If your child attends an interstate school district, Vermont, New Hampshire, how do you know which reach you for help?
I didn't hear that.
So if your child attends an interstate school, like between Vermont or New Hampshire, how do you know which state to reach out to for help?
Yeah, for a question like that, I would encourage that family to reach out to the Vermont AOE technical assistance so we can help figure out the nuances and give the right information. We collaborate often with New Hampshire, Massachusetts, so we have you know, partnerships with these folks. So start with us, and we can help navigate through those questions.
Great. All right. Well, that's all the time we have for questions. As we close our session for today, some upcoming virtual events that I wanted to mention. The Vermont Family Network will be hosting a series of focus groups to provide input to the Vermont Developmental Disabilities Council's next 5-year plan. And also there are several more workshops in the Vermont Family Network's online learning series. For info and registration, please visit the VFN website. I can't thank you all enough for attending today. I want to thank all of our presenters for your incredible information. I know this is an ongoing conversation that we'll continue to have. An evaluation is going to pop up once we end the webinar, and it will also be sent to you in a follow-up email along with a link for today's recording. So we ask you that you please take a few minutes to give us some feedback, and we hope you all have a wonderful day. Thank you so much for attending.